Dr. Ferrer, the floor is yours.
Good evening, and thanks so much for joining us for this town hall on pediatric vaccines. I'm Barbara Ferrer, and tonight I'm joined by Dr. Muntu Davis, LA County's health officer, Dr. Tara Shida, the Associate Director of Acute Communicable Disease Control, Dr. Jagane, a pediatrician with public health, Dr. Hema Morales Meyer, Director of Clinic Services, and Dr. Kurian, one of our regional health officers. To start, I want to give you an overview of how we'll run this town hall. As always, we'll begin with some brief remarks from our panelists, and then we'll spend the rest of our time answering your questions. And thanks so much to those who already sent in their questions. As a reminder, you can send in your questions in the chat on YouTube, Facebook, or Twitter. As displayed at the top, we also have live translation services during our event tonight. Para escuchar en español, por favor, llamas el 888-664-1453. For Mandarin, the number, as you can see on the screen, 888-664-1459. For Korean, 888-664-1454. Before we move to opening remarks from our panelists, let me share the most current information on the COVID-19 pandemic. We continue to experience a lot of transmission of the COVID virus, and I'm sure you're all aware of that. Today, we reported over 65,000 new cases. This is the highest number of new cases we've reported in a single day since back in February, when we were in the middle of the winter surge. And contrary to circulating misinformation saying that children don't get infected, 1,300 of today's cases were among children under the age of 18, with 225 new cases just from today alone among children under the age of 4. With increasing cases, we also experience increases in COVID-related hospitalizations. There are 680 people hospitalized today, which is a pretty big increase from earlier this month when we were seeing an average of 400 hospitalizations. There are also increasing numbers of individuals sick with COVID that are seeking care at our emergency departments and our urgent care centers. More than 8% of visits at emergency departments this past week were from people infected with COVID. This is double the percent of individuals seeking care at emergency departments less than a couple of weeks ago. Fortunately, deaths remain relatively low, with an average of 8 deaths a day over the past week. And while this number remains stable, there is no other infectious disease where we report 7 or 8 deaths per day. Tragically, over the course of this pandemic, more than 32,000 people in LA County alone passed away from COVID, and this includes 11 children. We send our prayers and best wishes for peace and healing to those who are mourning the loss of a loved one, a colleague, or a friend. Additionally, we continue to track the impact of the pandemic using the Centers for Disease Control COVID-19 Community Levels Framework. As a reminder, this framework has 3 elements: the weekly COVID case rate and 2 hospital metrics: the 7-day rate of COVID-19 hospital admissions and the percentage of hospital beds that are occupied by COVID-19 patients. LA County remains at the medium community level. Our hospital admission rate is about 8 new admissions per 100,000 people, and the percentage of hospital beds that are occupied by COVID patients is just above 4%. As a reminder, if we reach either 10 new admissions per 100,000 people or 10% of our staff beds are occupied by COVID patients, LA County will be moved into the high community level. If LA County moves into the high level and remains there for 2 consecutive weeks, a universal indoor masking requirement for everyone aged 2 and older in LA County be implemented in alignment with the CDC framework. This safety measure would remain in effect until we return to the medium community level for 2 consecutive weeks. The newest projected date of crossing that threshold of 10 admissions per 100,000, which would move us from medium to the high community level, is now in the middle of July. But there are many things we can do that would actually slow the rate of transmission, and that would in fact slow the rate and the numbers of people that need hospital care. It's important to note that these high case numbers are being fueled by the Omicron variant, a highly infectious strain of SARS-CoV-2, which accounts for 100% of the sequenced specimens this week, as it did in recent past weeks. However, the various highly infectious subvariants of Omicron continue to evolve. The Omicron subvariants that we're tracking the closest are the BA.4 and BA.5 variants. To date, 16% of sequenced samples from a couple of weeks ago were BA.4. And for BA.5, that number is higher. This is 3.5 times higher than it was just 2 weeks ago. The CDC estimates that across the country, as of the week of June 18th, the BA.4 and BA.5 subvariants of Omicron combined accounted for more than 50% of specimens, a large increase from under 5% just a month ago. BA.4 and BA.5 are known to be more easily transmissible than the previous virus strains and are of special concern because of their apparent ability to cause reinfections in people who were infected with other Omicron subvariants earlier this year. So for those of you who were infected with BA.2 or BA.2.12.1 sometime in January, February, March, or April, unfortunately, we're seeing that folks who are infected with BA.4 and BA.5 were previously infected with the earlier strains of Omicron. Because of this constantly changing variant landscape, it's very hard to predict with any certainty what exactly the future will look like. We do know, however, and it's very clear, that given the uncertainty that we have continued to live with, and the fact that getting infected causes both disruptions and illness for so many, it's prudent for all of us to use all the measures we have that work to reduce COVID-19 risk. This includes vaccinations, boosters, masking, moving activities where you can outdoors, maximizing ventilation if you're staying indoors, and testing and staying home when you're sick. We do look forward to answering your questions, and now I'd like to turn it over to Dr. Terashita for some information about the pediatric vaccines and how they were developed.
Good evening, everyone, and thank you, Dr. Ferrer. I'm happy to be here this evening to discuss pediatric vaccines and how effective the COVID-19 vaccines are at protecting you and the ones you love, including our children. With the continued high case rates, it becomes even more important to get vaccinated and boosted as soon as possible. The vaccines continue to be one of the strongest tools we have against COVID-19. They are very effective in preventing infection and are extremely effective in preventing hospitalizations and severe outcomes of COVID-19. We see substantial reductions in cases and hospitalizations among fully vaccinated individuals, and even more significant protection for people who are fully vaccinated and boosted. For instance, unvaccinated people were about 2 times more likely to get infected with COVID-19 when compared to those who were fully vaccinated but not boosted. When adding a booster dose, protection increased significantly, as those who were vaccinated and boosted were 4 times less likely to be hospitalized than people who were unvaccinated. The evidence remains compelling that reducing community transmission, hospitalizations, and deaths, and preventing strain on the healthcare system are best accomplished if more residents are vaccinated and boosted. And for over a year, we have been asking, but what about our youngest children who are currently unable to get vaccinated? I'm very happy to announce that the COVID-19 vaccines are now available in LA County for children ages 6 months to 5 years. Emergency use authorization was granted to vaccinations from both Pfizer and Moderna. These vaccines finally give parents a critical tool for protecting their children. There has been a misperception that very young children do not experience severe disease. Since the beginning of the pandemic, almost 90,000 children ages 0 to 4 tested positive for COVID, and over 1,300 were hospitalized. Moreover, 103 children ages 0 to 4 have been diagnosed with multi-system inflammatory syndrome in children, also known as MIS-C. The Pfizer vaccine is for kids aged 6 months to 4 years and requires 3 doses. The Moderna vaccine is for kids aged 6 months to 5 years and requires 2 doses. The first 2 doses of the Pfizer vaccine should be given 3 to 8 weeks apart, and the third dose at least 8 weeks later. For the Moderna vaccine, the second dose should be given 4 to 8 weeks after the first dose. The size of the dose is smaller than in adults for both brands of the vaccine. The process the FDA uses to approve pediatric vaccines is considered the worldwide gold standard and involves an intense and extraordinarily rigorous review of patient-level data from trials. Over the course of other vaccine rollouts over the past 2 years and previously, the agency's attention to safety remains vigilant, and its communication with the public is timely and transparent when concerns arise. This is a process we can and do trust to do the absolute best for our children and ourselves. Once it was approved by the FDA and the CDC, Department of Public Health ordered mini doses and began administering them while focusing on accessibility to the vaccines, especially in the areas of Los Angeles County that have been hit the hardest by COVID-19. It is also important to mention that our children ages 5 to 11 are already eligible for a booster dose. Last month, the CDC expanded the eligibility of COVID-19 boosters to everyone 5 years and older. Children ages 5 to 11 should receive their booster 5 months after their initial Pfizer COVID-19 vaccine series. More than 4.8 million children have been diagnosed with COVID-19 in the U.S., and as we have said, thousands of those children live right here in Los Angeles County. During this announcement, the CDC also strongly recommended a booster dose for those 12 and older who are immunocompromised. As Dr. Ferrer mentioned, our case numbers are still high, and every day we are seeing more people die or becoming seriously ill from COVID-19. This unfortunately does tragically include our young people right here in our county. Many people will still have a lot of questions about whether the vaccine will be the right choice for their children. If you have concerns, we urge you to speak with your child's medical provider and check the CDC website and our public health website for more information. Keeping our children safe keeps all of us safe and gives us a path forward to recovery. Unfortunately, COVID-19 is not going away, and we are on the cusp of another busy summer of activities and family gatherings and travel. Please visit vaccinatelacounty.com or vacunatelosangeles.com in Spanish for vaccination sites near you. Many locations across Los Angeles County do not require an appointment. Many schools also have vaccination sites. Additionally, public health provides in-home vaccination appointments for people who are homebound and are unable to visit a vaccination site. Again, please visit vaccinatelacounty.com to fill out the online request form or call the Department of Public Health Vaccine Call Center at 833-540-0473, open daily from 8 a.m. to 8:30 p.m. Thank you, and I'll now turn it over to Dr. Nava Yagana.
Dr. Tereshita, excited to be here. Discuss the pediatric vaccines and why they're so important.
Nava, can you just talk? We need you to talk a little louder. It's a little hard to hear. Sorry.
Is that better? Can you hear me now?
Much better.
Okay, I'll try to start again. We appreciate the opportunity to discuss pediatric vaccines and why they're so important in our fight against COVID. To start with, even though children do have less risk of severe illness than adults, children who get COVID-19 can still get very sick and can require treatment in a hospital. Tragically, hundreds have even died. We know that particularly in children under the age of 5, more than half who have been hospitalized did not have an underlying medical condition. Some children with mild illness also get multisystem inflammatory syndrome in children, or MIS-C, a few weeks after their infection. This is a condition where different parts of the body can become inflamed, including the heart, the lungs, the kidney, the brain, the skin, the eyes, and the gastrointestinal organs. We don't know what causes MIS-C. However, we do know that in some children, MIS-C can be serious and even deadly. Luckily, we know that children who are diagnosed in a timely manner with this condition can have been gotten better once they receive appropriate medical care. If you think your child is sick with MIS-C, you need to contact your child's doctor or clinic right away. Signs and symptoms of MIS-C include ongoing fever, plus stomach pain, bloodshot eyes, diarrhea. Some kids get dizziness or lightheadedness. Some have skin rash, and then some also will have vomiting. To date, in Los Angeles County, we've had over 300 children diagnosed with MIS-C, and 103 of these children have been ages 0 to 4. This is another reason why we encourage all parents to vaccinate their children. As with adults, there's also children who get infected and suffer from post-COVID conditions, sometimes known as long COVID or long-haul COVID. Children who have these symptoms may feel tired, have headaches, and have trouble focusing for weeks to months after getting COVID-19. Again, I think it's important for us to remember that even healthy children with no medical conditions can be hospitalized or have long-term complications that can affect their mental, physical health, and their quality of life. Unfortunately, there's no way to tell if an otherwise healthy child will get sick with severe COVID-19, MIS-C, or long COVID. But we do know that vaccination reduces the risks of getting all these complications. Additionally, many children and teens with disabilities have an underlying condition, such as being overweight or obese, having asthma, diabetes, having a weakened immune system. Children and teens who have one or more underlying medical conditions are more likely to get severely ill from COVID-19. Children and teens who have developmental disabilities such as cerebral palsy, intellectual disability, autism, may be more likely to experience mental health conditions from social isolation. They can also experience barriers to getting the needed care and other support, and have other characteristics that may increase their risk of COVID-19, including limited mobility, need for important support services, challenges of practicing preventative measures. They might have difficulty wearing a mask or doing appropriate hand washing. They also might have challenges in communicating symptoms of being ill or being sick. I understand there's a fear or uncertainty if you have a child with an underlying medical condition, but the vaccine studies that were done included children and teens who had underlying medical conditions, and this vaccine was both effective and safe. With that, I'd like to turn it over to Dr. Gemma Morales-Meyer.
Good evening, and thank you for joining us. As was mentioned before, the Pfizer vaccine is approved for administration to children ages 6 months to 4 years and requires 3 doses, each a few weeks apart. The Moderna vaccine is approved for children aged 6 months to 5 years and requires 2 doses given 4 to 8 weeks apart. Additionally, the Moderna vaccine for children 6 to 17 years of age was just approved, and LA County should be receiving these vaccines next week. One important thing that parents should know as they prepare to vaccinate their child is that vaccinations are always free and open to eligible residents and workers, regardless of immigration status. Appointments are not needed at public health vaccination sites and at many community sites where first, second, and third doses are available. To find a vaccination site near you or to make an appointment, please visit www.vaccinatelacounty.com and en español, www.vacunatelosangeles.com. If you need assistance, you can also call 1-833-540-0473 for help finding an appointment, connecting to free transportation to and from a vaccination site, or to schedule a home visit if you are homebound. While your child doesn't need an appointment at many places to get a first, second, or third dose, it is very easy to make an appointment for a booster dose. You can go to myturn.ca.gov or to our website at vaccinatelacounty.com to make an appointment and for more information about booster shots. You can get vaccinated at any of our hundreds of mobile sites or at one of our more than 2,000 fixed sites countywide. Additionally, many pharmacies and clinics countywide may be accepting appointments through their own systems. If the place where you got your primary vaccine series was convenient for you, you can check back with them now to see if they are offering booster doses. All you need to bring to your appointment is proof of your primary vaccine series, such as your white vaccination card, a photo of your vaccination card, a medical record that documents you have received these vaccines, or your digital vaccine record. Also, you can safely get your first, second, or third COVID vaccine at the same time you receive other vaccines, including flu shots. The best schedule for getting both these vaccines is one that doesn't delay either of them. All of the county DPH sites and most pharmacies are offering both COVID and flu vaccinations. And for children, there are almost 180 healthcare provider practices, about 230 pharmacies, over 500 mobile vaccination clinics, and our 7 public health vaccination community sites and 4 of our public health clinics, Antelope Valley Health Center, North Hollywood Health Center, Whittier Health Center, and the MLK Center for Public Health, with 2 more, Central Health Center and Hollywood Wilshire Health Center, planning to offer vaccinations for young children in the coming days. Please note that a consent form is required for all minors through age 17 at each visit. Children 6 months through 15 must be accompanied by their parent, legal guardian, or a responsible adult. If the child is accompanied by a responsible adult, the consent form must name the responsible person and be signed by the parent or legal guardian. Also, 16 and 17-year-olds should be accompanied by their parent or legal guardian if possible. If this is not possible, they must bring a consent form signed by their parent or legal guardian. And now I'll turn it over to Dr. Sarah Kurian to talk about therapeutics.
Good evening. Thank you, Hema. I'm happy to be here with everyone this evening to discuss the access to COVID-19 therapeutics and then answer your questions. As it has been discussed, the vaccines provide powerful protection for adults and children. As a reminder, anyone who does test positive should stay away from others and follow public health's isolation guidelines. While many people with COVID-19 have mild illness and can recover at home, others are at higher risk for getting very sick. Those who are at elevated risk for severe COVID-19 infection, hospitalization, or death may be eligible to receive treatments which can prevent negative outcomes. There are currently 4 treatment options that are available and 1 medication that is used to prevent COVID-19. All these medications must be prescribed by a healthcare provider. Some can be taken by mouth, and other therapeutics are given by injection or infusion. 2 of the treatment options, Paxlovid and Molnupiravir, are antiviral medicines that are taken by mouth to treat mild to moderate COVID-19. Paxlovid is for people ages 12 and over who weigh at least 88 pounds. Molnupiravir is for adults aged 18 or over, but is not recommended for use during pregnancy and is only recommended if other treatment medications are not available. Both these medications require a prescription from a healthcare provider, and these prescriptions can be filled at hundreds of pharmacies across the county. Bebtelovimab is a monoclonal antibody given by IV infusion, which is available at many clinical sites. Remdesivir is an antiviral medication that's approved for both inpatient and outpatient use for adults and for children. It is the one treatment that is currently available for those under 12 years of age who weigh at least 7 pounds and are at least 28 days old. The final medication, Evusheld, is not used to treat COVID-19, but rather to prevent infection. Evusheld is administered by injection and is available for people who have not had recent contact to COVID-19 and who can't get a COVID vaccine due to having a severe allergic reaction to a component of the vaccine. It's also recommended for people who may not respond well to a vaccine because they have a weak immune system due to a medical condition or a treatment that they are on. There is currently ample supply of all the therapeutics, and we currently have a network of 1,000 sites, including pharmacies, clinics, and hospitals, where COVID-19 therapeutics are available. To date, Public Health has distributed nearly 70,000 courses of these life-saving medications to providers and facilities, with 64% of Paxlovid doses and 67% of Evusheld allocated to providers in the most under-resourced communities. I know there are a lot of questions about what medications are available and how to access these drugs. But the first thing everyone should know is that the medications to prevent and treat COVID-19 are intended for people who are at elevated risk for severe COVID-19 illness, hospitalization, and death, and must be prescribed by a healthcare provider. If you think that you may be a candidate for one of these treatments, ask your provider if you're eligible. If you don't have a provider, request an appointment from a clinic that's part of the network of providers offering these therapeutics. You can access a list of these clinics from our therapeutics website at www.ph.lacounty.gov/COVID medicines, or on our Spanish language therapeutics webpage at www.ph.lacounty.gov/COVID medicamentos. If the provider indicates that you are eligible, you can take your prescription to a participating pharmacy. You can visit our website for a list of these pharmacies as well. There is also the Test to Treat program, which allows patients to walk into local pharmacies or clinics that offer testing, evaluation, and treatment at the same visit and at the same location for eligible individuals. If they've already been tested, residents can also bring their positive tests to the site to receive the medication if the on-site provider recommends and prescribes the treatment. These participating sites can also be accessed through our website, and we continue to work on expanding this program. Residents who would like to learn if they are eligible for treatment, access these medicines, or have questions on which treatment is right for them should contact their medical provider or can call our COVID-19 information line at 833-540-0473, open 8 a.m. to 8:30 p.m. daily. The call center is a free resource where residents can get information about available therapeutics and how to access them. We also offer a telehealth option through the call center where residents who have tested positive can speak with a provider and be prescribed medication if eligible. For patients that cannot leave their home, medication can also be shipped to your address through our telehealth service. Residents can also visit www.ph.lacounty.gov/COVID medicines or our Spanish language webpage at www.ph.lacounty.gov/COVID medicamentos. I look forward to answering your questions about these options in just a few minutes. But first, I will turn it over to Dr. Davis to talk about some steps families can take to keep each other safe.
Thank you, Dr. Kurian. Now, before we get to questions, I want to remind everyone about navigating the risk of getting COVID, which is going to be even more important as we prepare for the 4th of July holiday weekend, as community spread continues to be very high. We'd like everyone to start by considering their personal risk and the risk of each person around you when making decisions about precautions such as masking, gathering, getting tested, and getting vaccinated or boosted. One's personal risk is determined by a variety of factors. Characteristics that put you at higher risk of both getting or becoming very sick from COVID can include if you or someone in your household is not fully vaccinated or boosted, if you or any of your household members have a chronic condition such as diabetes, high blood pressure, or are immunocompromised, if you or someone you live with or care for is 65 years or older or too young to be vaccinated and boosted, if you or your household members are in close contact with people at work, school, or another community setting where people are unmasked, unvaccinated, or may be infected with COVID, and if the risk of spread in LA County is high as it is now. The more of these risk factors you have or that are in place, the more precautions you should take, such as always wearing a mask in indoor public settings, being cautious with going to indoor gatherings and events, especially if you don't know others' vaccination status who are there, getting tested before and after gatherings and asking others to do so as well, and getting vaccinated or boosted if you haven't done so already. And as mentioned, part of the risk assessment is also considering the risk of each person around you, whether they are your family, your friends, your coworkers, or others with whom you share public spaces. Are you around others in indoor spaces who may be more vulnerable or at high risk from COVID? They may have underlying health conditions, they may be unvaccinated, they may be elderly, or they may live with people at elevated risk. Are you engaged in activity where viral spread is more likely? You're singing, chanting, or yelling in close proximity to others. Are you playing a sport indoors that involves heavy exertion and close physical contact with others? Are you obtaining or providing a service that requires prolonged close contact with another person? Haircuts, shaves, facials, nail treatments, massages. All of these situations increase transmission risk and require consideration of additional safety precautions. This can include wearing a well-fitting, high-filtration mask to protect employees and coworkers, improving ventilation to circulate fresh air, moving activities where possible outdoors, testing before participating in activities where transmission risk is greater, and limiting capacity and activities in small, poorly ventilated spaces. Living with COVID continues to ask that each of us be aware of the need to protect those around us. We have so many tools that make it much easier to do activities we care about and be with the people who are important to us. We also have an obligation to use these tools for the greater good and to protect those most vulnerable. As we experience the uncertainty that comes with continued proliferation of the new Omicron variants, we remain hopeful that residents and workers in LA County can take the sensible steps that reduce the risk of getting infected and infecting others. Thank you. And now I'll turn it back over to Dr. Ferrer so she can start taking questions.
Yeah, thanks so much to all of our panelists. I think the information you provided is great and a good place for us to sort of start tonight's conversations. I do want to thank everyone who sent in questions. Feel free to go ahead. We have a lot of questions and appreciate everyone taking time out to join us tonight. Let me start with some questions just about vaccine effectiveness. Maybe I'll start, Dr. Jagane, with you. I think this is a great question. If the vaccines are so effective, does my child really need the 2 doses, or can I just get them that first dose?
Yeah, that's a really interesting question. There's actually really interesting data and very good data coming now for pediatric vaccines, especially for the 5 to 11-year-olds, that shows how incredibly important the second dose is, as well as the booster dose. So for the 5 to 11-year-olds, the first dose does provide some protection, but really the second dose elevates that protection significantly. And if your child is due for a booster, that booster dose will even result in a stronger immune response. So really, I would encourage everyone to get all the doses that they are due for at the time when they're due, to just help protect their children the best way possible.
Thanks so much. Dr. Terashita, sort of a similar and very important question. My son is autistic, and I'm concerned about the vaccines that go into his body. He's 3, and he already got COVID. Would it even help him to get a vaccine now?
Thanks for that question. The short answer is yes. Your child should get vaccinated even if they've already had COVID-19. COVID-19 infection does offer some protection shortly after the illness. It can be from anywhere between a few weeks to a few months, but that level of protection differs in different people, and it does wane over time. So we recommend getting the COVID vaccine in addition. You can either get it as soon as you recover from the infection, or there is a suggestion that you could wait for 3 months after your child first got COVID-19 for them to start or continue the vaccine series. The vaccine has shown to be safe and have a number of benefits, including preventing mild or severe illness. It also has shown to protect against MIS-C, as discussed. So we do recommend getting the vaccine in addition. Thank you. Oh, and in addition, if your child is in some way immunocompromised or has a lot of underlying medical conditions, it's additionally important to get the vaccine because you want to really protect your child against all illnesses, but definitely COVID-19. Thanks, Dr. Ferrer.
Thanks so much, Dr. Terashita. Dr. Morales-Myers, Similar question. This is an older child. My son, he's 7 years old, was infected by COVID on June 6th. Can you advise what date is he eligible to take that COVID vaccine, that first dose?
Sure. So the first dose, they should wait until they are recovered, if they had any symptoms, and they're done with their isolation period. But the first vaccine can be given soon after, once their isolation period is over. With new variants of the virus, it's really important to get vaccinated as soon as possible to make sure they have the protection that they need. We now have both Pfizer and Moderna vaccine available for children from 6 months to 17 years old.
Thank you, Dr. Morales Myers. I do want to note that for some parents, they want to wait longer, and waiting a little bit longer, that's fine. Really, your child does have some protection that they got from the vaccine, but as Dr. Morales Myers mentioned, that effectiveness, as I noted earlier in my comments, unfortunately, with BA.4 and BA.5, these new subvariants that are circulating right now, they don't seem to really be paying much attention to earlier infections. But the vaccines are still doing their job. They're protecting people from serious illness, hospitalizations, and deaths. So good idea to go ahead in. If you wanted to wait a little bit after they got infected, everyone is recommending, please don't wait any longer than 2 or 3 months to get your child vaccinated after they've been infected. Dr. Davis, again, I'm gonna try to sort of combine a few questions here, but there is a lot of interest in whether or not the COVID vaccine will be mandatory, and there's specific interest about whether it will be mandatory for children to go to school, but also would it be mandatory in other settings? So I wonder if you can talk a little bit to that.
Sure. It's a great question. I'll start with in other places, and then I'll come back to schools. Now, some businesses do have the ability to require vaccination of those who are attending their facilities or getting services at their facilities. I've seen it happen at some camps. I've seen it, for some trips, group trips, and I've seen it in entertainment venues as well. So there could be requirements related to the organizers of activities and facilities. In terms of school, we understand from the state Department of Public Health, that upon full approval by the FDA, that they will consider, and as well as the CDC, they'll consider implementing a school vaccination requirement. But that hasn't happened just yet. But they have stated that any vaccine requirements would not take effect until full FDA approval and no sooner than July 1st of 2023. So there is that possibility, but a lot hinges upon full FDA approval of the vaccines that are available for kids at the moment.
I also want to note that there are requirements for vaccinations for healthcare workers as well. So I don't want anybody to get sort of like thinking like, oh, there are no requirements. No, there are lots of us that are in fact required as a condition of employment because we're working with highly vulnerable people for us to be vaccinated. And as Dr. Davis said, any business could make a requirement as well. So there are places where you're going where, in fact, the workforce is completely vaccinated and boosted unless they have an approved exemption. So want to note that in many of our higher risk settings, those vaccination requirements have been in place really since pretty much since we've had vaccine. And they're offering a lot of protection both to the workforce and to people that are using those services. I'm going to go back to Dr. Yagane. Again, specific questions now that we got about, how to use the vaccine the best, like under what conditions, and some particular questions that I think are really important because I think they happen to lots of people. My child will turn 5 years old in a little over a month. Would their initial dose, because I'd like to get them vaccinated right away, be a pediatric dose? And then the second dose would be for the 5 years and older dose? And should I stay with the same vaccine product? So should I stay with Moderna? If I start with Moderna, should I go ahead and switch over to Pfizer for that second dose?
Yes, so that is a question that comes up frequently. So I'll handle the second part of the question first. The recommendation really is to stick with the same vaccine for the primary series, meaning that if you've chosen to get Pfizer for the first dose, we would encourage you to continue with Pfizer because that is the way that they were studied and evaluated. So as much as possible, if you could stay with the same vaccine for the primary series, we would encourage you to do that. And I think that's in accordance with what the CDC suggests as well. The second part of the question is about the ages. So if you, if you're 5 and you turn 6 and you're getting Pfizer, or if you're if you're 4 and you're turning 5, if you're getting Pfizer, and if you're turning 6, if you're getting Moderna, at that point you do have a choice. You can either get Moderna for the 6-month to 5-year-olds, or the Moderna for the 6 to 12-year-olds. Similarly for Pfizer, you can get the baby dose for both doses, or you can choose to get the dose for the older children.
Thanks so much, Dr. Yagane. And I just want to note, we lost your video. I'm not sure if you want to try to reboot yourself to see if you can get your video back. But
thank you.
Just want to let you know, I don't think it's just me that lost you. I think it might be a problem for folks that are watching and tuned in with us tonight as well. Dr. Terashita, there's a couple of questions on the boosters. So when are boosters recommended for school-age children who have recently recovered from COVID?
Okay, so this is a little confusing, and I ask that you talk to your healthcare professional. But right now, if you are a child, or if you have a child age 5 to 17, the booster dose is indicated at least 5 months after the end of your primary series, and this is for Pfizer. So for Pfizer, if you were 5 to 17, you would have gotten 2 doses. And again, the booster would be 5 months later with, again, another dose of Pfizer vaccine. For Moderna, boosters are currently not recommended, but five months have also not passed since the first doses of Moderna, as that was only recently allowed to be given.
Yeah, I think, and I do want to note a couple of things. One is Moderna for children 6 to 17 is still not here, although it's been approved. And we're hoping that we'll have doses of Moderna for that primary series. It just got approved starting next week. So there's really no child in LA County in the United States that has probably received the Moderna vaccine if they're under the age of 12, since it wasn't available for children until really just at the end of last week. So for most people, this is a question about Pfizer. Your child is younger school-age child, 5 to 11, vaccinated with Pfizer. This question was also specific, Dr. Terashita, to getting a booster after somebody has been infected with COVID. So 5 months have gone by. They're eligible for that booster dose. They're between the ages of 5 and 11. It's going to be Pfizer. But they got infected last month. When should they get boosted?
So very similarly, we recommend you get boosted as soon as you're eligible. And this is really to provide maximal protection. So if you got COVID last month and you are now asymptomatic and doing well, and you are eligible, meaning 5 months have passed since the end of your primary series, you should get it as soon as possible.
And we have a couple of questions I'm going to switch a little bit for Dr. Curry, and I'm going to put these questions together about confusion about testing and treating. There are a lot of people who are very interested in being able to access the new oral medications once they get infected. They are concerned because they have heard about or experienced themselves trying to get those medications and being charged an assessment fee. One person says it was as high as $60. So could you, I think just reiterate the county offers this service 100% free, and how people can go ahead and access a free service, because a lot of people are asking why they're getting charged, and why can't this all be free? So I don't know if you want to sort of just
Sure.
jump into that, Dr.
Yeah.
Curry.
Yeah, happy to. So I guess I will say that the therapeutics were purchased by the U.S. government and made available to local jurisdictions, to the states, and then we in turn have made that available to all of the providers that are in the network. So none of the providers can bill for the medication itself because they didn't have to pay for it. But providers can bill for certain other components of the services that they're providing, like when you actually see the doctor, or certain other components of that visit can be something that is billed for. So we do understand and recognize that that's going to be a challenge for folks, especially if you're uninsured or you're underinsured, and you're facing the possibility of having to pay some of those costs out of pocket. And so, as Dr. Ferrer mentioned, we do offer a telehealth service that provides all of the services free of charge. So for anyone who tests positive, you can call the number, and I believe we flashed it up on the screen a couple of times. It's the 833 number, and I'm sure our team can get that back up on the screen. Perfect. It's the 833-540-0473 number. And again, it's available 7 days a week from 8 a.m. to 8:30 p.m. You can call into that number if you've tested positive and you're curious about whether you're eligible for these therapeutic agents. There are nurses on the call line that can do some initial intake and then have you follow up with a physician by phone. They will then assess your eligibility, and if you're eligible, they will send you a prescription, or send a prescription to a nearby pharmacy where you can pick it up. Or if you can't go to pick up a prescription or pick up your medication, we can also have medication shipped to you overnight. And all of that, even the shipping of medication to your home, is completely free of charge. So that is an option that's available for you if you're uninsured, underinsured, having challenges with accessing medication, or simply just curious about whether you're eligible for these medications.
Yeah, thank you so much, Dr. Curry. It's probably a good time for us to just note, in LA County, you can get testing that's free. You can get vaccination. Everyone can get vaccinations that are free, and I'm going to talk about that in a sec. And you can get therapeutics and the assessment to determine your eligibility for therapeutics that are free. Now, you can also go to some places, particularly around the therapeutics, because it involves an assessment, and have someone try to charge you. But for those people who cannot afford that or don't want to get charged, please, please, please give us a call, because there is no need for people not to get these services because they're worried about getting charged for them. All three, getting tested, getting vaccinated, and getting therapeutics, if you're eligible for therapeutics, are free services in this county. Doesn't mean that there aren't some people that are trying to charge. The one place where, if people are trying to charge you, you should know it's a scam, is around the vaccines. You cannot get charged for either the vaccines or the office visit to have a vaccine, to get that vaccine, if that's the only thing that happens at that office visit. You may be asked to show your insurance card. You can't be denied if you don't have insurance, but you cannot be charged. So if you go somewhere to get vaccinated and someone is trying to ask you for a copay, they're trying to tell you got to pay and then get reimbursed from your insurance company, that is a scam. Nobody can charge you for getting vaccinated, not for the COVID vaccines. There's no direct charge for administrative fees, for copays, or coinsurance for the COVID vaccine. So please, like very quickly try to find a different place to get your vaccines if someone is trying to actually charge you. They can, in fact, ask you for insurance. They can bill your insurance company, but they can't bill you for what they didn't get paid by their insurance company. They can ask you to pay up front, and they can't require that you have insurance. So these vaccines are available to people with and without insurance for no charge. So I just want to get that in, because lately we've just heard about like way too many places where folks are being told they have to pay to get vaccinated. And I want to note that, we're very lucky to live in a country where these vaccines, the booster doses, they are all 100% free. Dr. Davis, I'm going to go back to you for a second, just because there are questions here that I think we could use your wise counsel on. What are the consequences to both the individual, an individual person, and to our community if people are not getting vaccinated?
It's a great question, and I think it depends on a number of things. So one, as we've talked about earlier, some places may require you to be vaccinated, and some employers may require you to be vaccinated or have an approved exemption in order to work or at their location. For those locations that require vaccination for entry, if you don't have that and they don't offer another option, then you may not be able to enter. Also, if you are eligible for vaccination and you just choose not to, it does potentially put others at risk should you become infected. And we know over the course of this pandemic that many have been infected and not known it, which means that they may have unknowingly passed that infection on to someone who's at higher risk and experienced severe illness or passed away, or to someone who cannot be vaccinated for medical reasons. So there is some community benefit to others around you who you may not be aware of, who aren't able to be vaccinated, who are at high risk, and would benefit from you being vaccinated while you are around them. So we again sort of stress both the personal risk of not being vaccinated, but there's also a community risk as each of us are interacting with a number of people on a day-to-day basis. And transmission can happen very quickly and sometimes without even knowing.
Thanks so much, Dr. Davis. I'm going to go back. We just got a whole new set of questions in. So, and thank you for everybody who's asking. These are great questions. Dr. Morales Myers, I think this is an important question, and I know you touched on this, but we have like 3 questions about this. This person lives in Lancaster, has no idea where to go to get the vaccine for her daughter because they don't have health insurance. So how can we help?
Sure, that's a great question. And as we've mentioned, hopefully our team can put up our graphic. You can go to vaccinatelacounty.com and search by zip code, and it'll provide you the locations that are closest to that area. You can also go on My Turn, or if you need assistance, you can call 833-540-0473.
And just to again emphasize, there is no charge for vaccines. So please, not having health insurance, that is not a barrier to getting anybody vaccinated here in LA County. Dr. Terashita, there is a question on the pediatric vaccine. Are these shots already modified to protect against the Omicron subset of COVID? And then are we all looking for another booster, including pediatric patients in the fall?
Yeah, this is a very timely question. The FDA Advisory Committee has actually just ended some discussion on the booster doses, and this would be for both adults and pediatrics that are eligible for booster vaccine. The companies Pfizer, Moderna, Novavax, they all shared some immune response data for booster vaccines with the Omicron variant, and they all showed a more robust antibody activity against the Omicron subvariants. which is very encouraging. So I think we will hear more about this, but the anticipated new Omicron specific booster dose, may come out in the fall, October, November time period.
Dr. Giovanni, do you want to just chime in on Novavax? Because Dr. Teresita mentioned it. We do have a question. When will the Novavax vaccine be available, as it appears to be superior to the mRNA vaccines?
Yeah, so Novavax was discussed by the same FDA advisory committee. They discussed it in their first meeting, of this month. So I think June 8th was the meeting, and they did look over the data, and it did seem to be safe and effective. As far as whether it's more effective than the mRNA vaccine, I think that remains to be seen because Novavax data was collected during a time when we didn't have Omicron circulating. So it was during the time when we had more of the ancestral strain of COVID-19, but it did show to be very effective against that strain, 100% as far as severe illness protection against severe illness, and the protection against symptomatic illness was in the high 90s. So very, very effective. The FDA is waiting to hear a little bit more about the manufacturing of Novavax, and once they have more information about the manufacturing plans and how it will be produced, I expect that they will make it available to the public here in the United States as well. And this is, again, vaccine for those who are 18 years of age and older. They don't have a pediatric product that I'm aware of, but hopefully we will have yet another vaccine choice for everyone.
Thanks so much, Dr. Giovanni. Dr. Morales Myers, there are some questions here about side effects to the different COVID vaccines for children under 5. So I think there's two questions sort of buried in here. One is, what are the possible side effects for the vaccines for our youngest children? And then, are there differences between Pfizer and Moderna in terms of the side effects? And I think also in terms of the effectiveness of the vaccines. And we could split that out in 3, and Dr. Giovanni can sort of help with some of that. If I know it's a lot of questions here. Very good question. Whoever sent it in to us, great question. But maybe you can start, Dr. Morales Myers.
Sure. Yes, very good questions. The vaccine can cause some side effects similar to other vaccines that children and adults receive. So you can feel some pain at the injection site, a little bit of tenderness, possibly a fever. All of these side effects are common and should go away within 24 to 48 hours. So definitely, and some people don't get side effects, which is also true. And that doesn't mean that the vaccines are not effective. They're still effective, but it's a different response for everyone, and everyone responds a little bit differently. In regards to the vaccines, which one is better? Both have been approved by the FDA. Both have approval from the CDC, and both have been approved to be given to both adults and children. So either vaccine is available, and we recommend either vaccine. What is available, we recommend that you receive that as well too. And Dr. Yegane, if you want to comment a little bit further on that, feel free to.
No, I agree with you. Absolutely, Hema. So I think that, both vaccines did go through a really rigorous process. One vaccine for the under 5 age category, especially, one vaccine is a 3-dose series. Another vaccine is a 2-dose series. I think that the antibody response for both of those vaccines were similar, similar to what we see in adults with the adult dose vaccine. So we expect that their effectiveness will be equal. And we'll continue to look at that. As far as safety goes, both vaccines were very, very safe. There was a little bit more fever with the Moderna product, so that's just something for people to be aware of. It is a little bit of a higher dose vaccine, so if that is of concern, Moderna does maybe cause a little bit more of a fever as a side effect. Pfizer a little bit less. Moderna is 2 doses, so you can get protected a little bit quicker. Pfizer is a 3-dose vaccine, so you might have to wait a little bit longer to be fully vaccinated. So just some things to think about, but they're really minor differences and more about your personal preference and less about how effective the vaccine is.
Dr. Ugani, I'm just going to stay on you just for a sec. I think very critically important questions on this latest round, so I just want to try to get to as many as possible. Is height and weight considered for the pediatric dose? My 5-year-old is very small.
So in general, for vaccines, we look at the immune system and how robust your immune response is to vaccines. And so the best way to do that is to look at the age of the person. So we don't consider weight, we don't consider height. It is a tiny, tiny little dose, and it really only affects that area until your immune system is able to take care, react to it and build a strong immune response to the vaccine. So it has nothing to do with weight, height. It really is on how good your immune system is. And in general, children have a very strong immune system. So that's why we can give them a smaller dose of the vaccine and still have it be very effective.
Yeah, thanks so much. Dr. Davis, do you have any tips to stay safe while traveling to visit grandparents in Arizona?
Yes, as we say in terms of travel, when you're in public transportation, especially when you're in LA County or coming back to LA County, you are to wear a mask in indoor settings. And I would say the same thing wherever you fly to, whether it's across the country, across the world, wear a mask because you are in close quarters with others. And will be there most likely in terms of travel for more than 15 minutes, definitely. As well as making sure that you test before you go, just to check your status. If you test positive, of course, don't go. If you're sick, don't go. As well as making sure that you are vaccinated and, if eligible, boosted. Those are the best things to reduce your risk of both getting COVID and transmitting to others. Also, when you are around others, and especially if you haven't been around them, you don't know their status, or they're not vaccinated, or they're at high risk, try to move activities outdoors if you have lots of people around and you're going to be eating or drinking. That's also going to be safer and reduce the risk than being inside in a place that's not well ventilated. So again, masking, testing, before and after travel, as well as making sure you're fully vaccinated and those around you are, will help reduce your risk when travel.
Thanks so much, Dr. Davis. I'm going to switch over just for a minute to therapeutics. I know there's some questions coming in, so be patient. I'm trying to sort of make sure I hit everyone's questions. But Dr. Kurian, there's questions about the side effects for the oral medications, the antivirals. What are the side effects, and how do you know if you're going to be a good candidate for taking these antivirals?
Yeah, no, thank you. Those are good questions. So the common side effects of these oral antivirals are, sometimes some GI upset, some nausea. I will note that with Paxlovid, one of the side effects that is often talked about, maybe not very common, but people definitely talk about it, is sort of this metallic taste that you might experience in your mouth. And this is mainly because of the ritonavir component of Paxlovid. But nonetheless, for people, they may experience that while they're on the medication, but as soon as they come off the medication, that side effects does disappear. In terms of who's really a candidate for these medications, so both these medications do work a little bit differently, and so have a slightly different groups of people for which these medications are recommended for. So Paxlovid is a highly effective oral antiviral, but there are some considerations that healthcare providers need to consider before they prescribe Paxlovid, and that includes things like the other medications that a patient might be in. Paxlovid does have a number of drug-to-drug interactions, and so a healthcare provider would need to have information about what other medications a patient is on and ensure that there aren't those drug-drug interactions that may occur. For folks who do have an issue that prevents them from taking Paxlovid, the other oral antiviral molnupiravir is an option that they can use. Again, as I noted earlier, molnupiravir is not recommended for use in pregnancy, and there are some conditions that patients who are on molnupiravir need to adhere to in terms of making sure that they're using contraception for a certain period of time while they're on the medication and then also afterwards. So those considerations are things that a healthcare provider might consider in terms of determining which medication is right for them. So really important for people who are thinking about getting on these meds to really convey their medical history to their healthcare provider, especially if it's a new healthcare provider that hasn't necessarily taken care of you before, letting them know about any other medications or any other health conditions that you might have so that they can make the appropriate choice regarding which antiviral is best for you.
Thanks so much, Dr. Kurian. Dr. Terashita, we have a few questions about this, and I think they're important questions. There's concern that because there are side effects to the vaccine, people can get a fever, they can feel lousy for a couple of days, they get bad headaches, their arm hurts. Given that the risk to children is relatively low for getting seriously ill with COVID, there are a whole set of questions here about, given that there are side effects to the vaccines, why bother getting children vaccinated, since many children are not getting infected, and those that are getting infected don't seem to be having some severe, these folks' experience is that their children didn't really get all that sick.
Yeah, that is a good question. And we've been very lucky in this pandemic that children haven't had very severe illness when they have been infected with COVID-19. That said, we know children can get severe illness. We've had many thousands of kids who have been hospitalized, and even a few children, as Dr. Ferrer said, who have unfortunately passed away. So kids can get severe infection from COVID, and we have a safe alternative vaccine that will prevent COVID-19. So we do recommend the vaccine for COVID for kids. In addition, kids can pass on infection to others. So your kid may not be, immunocompromised, but they may see other kids who are immunocompromised and can get very ill. They may visit elderly individuals like their grandparents, like others who they could give COVID-19 to unintentionally, and that other person could get very ill. So there's many reasons we don't want children to get infected. In addition, there have been severe consequences in children, not associated with an actual illness, but some sort of after effects of the illness, such as MIS-C, multisystem inflammatory syndrome in kids, or long COVID. So additional reasons why you want to protect your children from COVID-19. And again, the vaccine is the best way to prevent your kids from getting COVID-19.
Thanks so much, Dr. Terashita. Dr. Igane, I don't know if you want to add anything about, sort of the nature of the side effects that we've been seeing in children, and sort of how you weigh that. I mean, you get side effects with almost any medication, or you can get side effects with almost any medication. So I think it's worth reminding all of us, like, we get very focused on, oh my gosh, there's a side effect, but every single medication that anybody takes has side effects, and some people get those side effects and some people don't. But generally, if your physician, your nurse suggests that you need to take a medication to protect yourself, we all kind of put up with the inconvenience of having side effects, because we know how important it is for our health to get better. So sometimes I think we think of side effects as serious consequences to taking the medication, but they're really two different things. And I don't know, Dr. Igane, if you want to just sort of focus on what we know about sort of serious side effects or serious consequences that we've seen amongst pediatric patients with either of the vaccines that are approved now?
I think, you said it well, and Dr. Terashita also stated it really well, that now we've given the vaccine products to millions and millions of children. We've been studying their safety. We've been looking at their efficacy. And first of all, I challenge that notion that children don't get COVID or don't get very sick with COVID, because they do. We know over 2 million children less than the age of 5 have gotten COVID-19 in the United States. We know hundreds have been hospitalized. So I don't think that this is a benign, non-pediatric illness. Kids can get sick with this, and you really just have a choice of whether you want your child to get COVID, without vaccine, without the protection of vaccine, or with the protection of vaccine at a certain point. As far as the serious side effects, there is one serious side effect, or I guess maybe two. The first one is anaphylaxis. That's something that you can have with any vaccine, any medication, any food, any clothes, and you can't have a serious allergic reaction to almost anything. So there is that very rare risk of having a severe allergic reaction, which we, haven't really seen a ton of, but it is something that we are aware of and something that can be treated if that should happen. The second more,
we keep everybody for at least 15
minutes.
After
we observe
that's
them.
what's likely to happen.
So we're all ready to react. Every person who's giving vaccine is ready to react should there be a severe allergic reaction. Again, really uncommon. The second one is something that's mostly seen in young men. So, I guess children and adults who are between the ages of 12 and 39 can get this rare, inflammation of the heart, which has happened with greater frequency associated with the second dose of Pfizer or Moderna vaccine. And again, this is very rare, but can happen and is often treated with rest, maybe some fluid, some observation by specialists. And we do know that if you get COVID-19, your risk of myocarditis and pericarditis is way higher, anywhere from 2 to 8-fold. So again, I think the risk-benefit ratio really does suggest that vaccines are so much safer. So if you had to choose, you would obviously want to protect your child as much as possible.
Thanks so much. I'm going to just stay with you for a second, Dr. Jagane, just very specific questions. My 9-year-old son recently diagnosed with type 1 diabetes. We have a question from somebody whose son also was recently diagnosed with asthma. Can they get the booster when they're eligible?
Yeah, of course. I mean, I think it is really important to get the booster and to offer your children, especially if they have an underlying condition that's associated with worse outcomes with COVID-19, to protect them as soon as possible. Like Dr. Ferrer and Dr. Davis has been mentioning, we're at a time where we're seeing a lot of community transmission. And we do know that children who have underlying conditions, including asthma, diabetes, obesity, developmental delay, they're at higher risk for having more severe illness and being hospitalized. So we want to offer them as much protection as possible. So I would definitely get that booster when they're eligible.
And just one more question, very specific question. For babies whose moms got vaccinated while they were pregnant, are there any protections from that for the baby? Can I still breastfeed? So this is, obviously an infant.
Yeah, I think this question also comes up, frequently that, what can we do for these children under the age of 6 months? So we have vaccine now for 6 months and older. We still don't have a vaccine product for children who are less than 6 months. And I'm not sure if we're going to have that, but we do have really good evidence that if the mom is vaccinated, the antibodies are transferred transplacentally in utero. So while you're pregnant, you can give antibodies to protect your baby from COVID-19. And these infants whose mothers are vaccinated are protected by these antibodies. And it does keep them safe from COVID-19. We also know that if you get vaccinated after you give birth, and you will have antibodies in the breast milk and and that can also be, used to protect your child at that additional layer of protection. So for now, I think definitely, making sure you're up to date with all your vaccines during pregnancy and breastfeeding will help you protect your baby that much more.
Thank you. Dr. Morales Myers, a 4.5-year-old boy in foster care is being sent to visit his grandparents by plane on July 15th. Should he receive his first COVID-19 vaccine prior to this flight?
It's a good question. Definitely, the age now is 6 months and older to receive COVID vaccines. And so it is important to get our children vaccinated and make sure that they have the protection. It is important to do that at least 10 days before any potential exposure so that they have at least coverage. And just to also remind folks that it does take, either depending on which vaccine that you're taking, it either takes 2 or 3 doses to complete that series and get full protection. So there's a lot of things to consider, but definitely we do encourage that everyone 6 months and older get their vaccine as soon as possible.
Thank you. Dr. Davis, a few questions on this. They come sort of, I think, from different perspectives. But one person goes, why are we not doing a mask mandate with so much transmission? We're very tired of being scared and feeling like we have to stay home because in so many places, people are not wearing a mask.
Well, we've had this strong recommendation for people to wear a mask in all indoor settings. Some businesses have assessed their situation, their risk for their workers, and they require it there as well. You can wear your mask even as an employee inside of places. And we've also set out criteria based on the CDC as to when we should go back to requiring masking by everyone 2 years and older in indoor public settings. And that is looking at the CDC's COVID-19 community level, which once we hit that high level and we maintain that for 2 consecutive weeks, which would indicate that there's some strain and increased strain on our healthcare system, that we would have that requirement in place. But we also have, fortunately, seen not as rapid a rise as with hospitalizations, although we are seeing high numbers of people getting sick, which is why we continue to strongly recommend, or infected, that we continue to strongly recommend that people wear a mask in indoor public settings. But again, we've set out the criteria for when we would put that masking requirement back in place.
Yeah, thanks so much, Dr. Davis. And I want to reiterate, what something Dr. Davis said that I think is so important. For people who are, really at higher risk and feeling nervous, because I agree, it can be nerve-wracking to go some places where you're indoors. It feels like it's pretty crowded, even a store, pharmacy, and most people are unmasked. If you wear well-fitting respirator mask, you are going to have a lot of protection. So I urge people, who are, still remaining basically in their homes, to talk with somebody you trust, talk with your provider, particularly if you have underlying health conditions. Find a well-fitting respirator mask, and make use of the fact that while, yes, the optimum situation is if everyone around you is wearing a mask, but if you've got that well-fitting mask on and you don't take it off, you're going to have a lot of protection. I also want to dispel sort of the rumor that everyone is getting infected, so we don't really need to do anything at all anymore, because it doesn't matter. If you're vaccinated, it doesn't matter. If you're not vaccinated, it doesn't matter. If you're wearing a mask, it doesn't matter. None of that's true. None of that. It's all misinformation. If you're wearing a mask and it's well-fitting and it's a high-quality, high-filtration, preferably a respirator mask, you got a lot of protection. If you get vaccinated and boosted, you have a lot of protection. Of all the, I think, I want to say 7 million people in LA County that have been vaccinated, fully vaccinated to date, 13% of them have become infected. And even if we want to say that number, it's not accurate because lots of people are testing at home, double it. 26% got infected. Go even higher, say 35% of people who got vaccinated got infected. the vast majority of people who got vaccinated have not necessarily gotten infected. I think it's really not accurate to say that you don't have any protections, that there's nothing you can do. Everyone is getting infected. There are millions of people in LA County that have not gotten infected yet. It doesn't mean you're not going to get infected. There's a lot of transmission going on. We have to be super careful and cautious, but I don't want people to think that the tools that are out there don't work at all, because we've got a highly easily transmissible variant. Because we have no data that says that. All of our data says that using these protections, layering in these protections, helps you avoid getting infected and just reduces your risk. So nothing's perfect. Nothing's perfect right now. But I think it's really a lot of misinformation that because nothing is 100%, don't do anything. I think, we all have learned a lot in these last 2.5 years, and, we're grateful for all that you're doing to keep each other safe. But I don't think we should be giving up because we have a lot of transmission and we're really sick and tired of having this virus amongst us. I think protections still work. Some of those are much easier to do than others, and we can all get behind them and really help protect each other. And even if you got infected once, you can get infected again if you don't take some precautions. So please, I think you've heard from all of us the importance of getting vaccinated and boosted, even if you were recently infected. I'm gonna, just sort of go around and ask. We got some great questions here that we're not going to get through tonight, but I want to note we will post responses to the categories of questions that we didn't get to. I think we got to a lot of this. A lot of the topics. But one question that came up a lot was, what are the best strategies to use to encourage parents of young children and even school-age children to get their children vaccinated, and for those that are eligible, boosted? And so I might just ask that we go around, everybody can give sort of what they think is, sort of an idea for how we can, continue to work with families that have not yet gotten their children vaccinated. And, why don't I start with you, Dr. Morales-Myers?
Sure. So that's a great question. I think really timely as these vaccines are now available. One of the things I like to do with family members, friends, and some of our patients that come in is to ask them, what are their concerns with getting vaccinated, and talking to them, taking the time to really talk with them and understand what those are, and really dispelling any myths, really letting them know what the science out there is, and making sure that they understand why it's important for their children to get vaccinated, and why it's important not just to the child, but to the family and everyone that comes in contact with them. So one of the strategies I would say is take the time and talk to folks and find out what their questions are. And if you don't have the answers, also, tell them to talk to their doctor or a professional.
Oh, thank you so much. And maybe Dr. Kurian? Try to go down the line.
Sure. I think one of the things that I would elevate, just because I was talking about therapeutics, is that currently there really is only one therapeutic agent that's available for children under the age of 12. And that agent requires 3 days of IV infusion. So it's not an easy medication to access or to actually use. And as I think many folks on the panel talked about this evening, children do get sick, and children can get sick enough to end up getting hospitalized and having severe disease. And so with the reality that, there aren't a lot of treatment options, especially for the very young children, it really, really remains extremely important to vaccinate your children and keep them protected.
Thank you, Dr. Kurian. We'll go ahead and maybe we can go over to Dr. Yagane.
So I think I echo a lot of what's been already said, but I do also think that we have to make sure that vaccine is easily accessible, information about the vaccine as well as the vaccine itself. So To all my pediatrician colleagues out there, really making sure that every opportunity you have to talk to patients, that you are able to offer them vaccine, that we don't have any missed opportunities to make sure that our patients are safe. And if patients are not ready yet to get vaccinated, I think this is a good opportunity to figure out what strategies they're employing to keep their children safe. So how can we keep our kids healthy through this pandemic and making sure that they are able to really enjoy their childhood to the fullest?
Thank you. Dr. Terashita?
Hi. Yes, it's really hard to go after everyone. I agree with what everyone has said. I'm going to say it's the community. It is all of you. Um, there's many studies that show behavior changes when to help people make behavioral changes. One of the things they do is they go to their friends. And they talk to their friends, and that helps them make informed decisions. I think we talked a lot today about the science, about the education, FDA, CDC. But what I really want to encourage everyone who's listening is really, take what we said and pass it on. It's really you, the friends, the community that can really help convince everyone that this is a safe thing. We are at a very exciting day. We have been waiting for this day when our youngest, most vulnerable individuals, in some sense, can get vaccinated. It's so exciting, and so now is the time to push it out. Tell your friends, tell your family, get vaccinated. It's what you can do to keep them safe, to keep you safe, and to keep the community safe. Thanks.
Thank you so much, Dr. Terashita. Dr. Davis?
Thank you. First off, thanks to all of my colleagues in terms of presenting and information and answering questions. I think the key in this is really, kids are one of our most valuable parts of our community. We always want to protect them, and this pandemic has been here for over 2 years now. The virus has changed a number of times, and the safest and most effective way to protect them is for them to be vaccinated now that they are eligible for 6 months and older. So it's really important to do our best to have them protected in the safest way possible, and that would be to get vaccinated. If there are questions, we have lots of questions on our website. You can talk to your providers. You can cross-check information. But really, in order to keep our kids safe, the safest way possible would be to be vaccinated, given what we've seen over the last couple of years.
Yeah, thank you so much. And I'm just before I close us out for tonight, and with thank yous to everyone, people are on the call as well as our amazing panelists. I do want to just do a reality check because I'm looking through the questions that are coming in, and there's a lot about like children don't get infected. So just so folks know, we've had over 600,000 children under the age of 18 in LA County test positive for COVID. And in that, almost 100,000 of them were children under the age of 4 or 4 and under. And remember, lots of children have had mild illness and they may not have been tested. And this doesn't include any of those at-home tests that are being used. So I think for us in public health, we see this information all the time. We see that every single day there are hundreds and hundreds, thousands of children that end up infected. And we look at our hospitalization data, and it's not a dozen children that are hospitalized over the course of this pandemic. Here in LA County alone, it's thousands of children have been hospitalized. So we just need to remember that there are risks associated with COVID, even if you don't know about them because you personally haven't experienced them. The numbers actually don't lie. Over 32,000 people have died in 2.5 years from COVID in LA County. We have almost no other singular disease that has caused this much death or devastation that period of time. And tragically, 11 of the people who passed away were children, and 2 of those children were under the age of 5. You can't really, dismiss that. Children don't die of infectious diseases in this country very often. So with a vaccine that prevents children from getting serious illness, hospitalization, being hospitalized, dying, we do need to make sure that people understand there are some very real risks associated with COVID still. And that's why, millions and millions of dollars have been spent to develop safe and effective vaccines for our youngest children as well as everyone else, is because this virus is devastating, has been devastating to so many. So, I appreciate everyone's questions. I know how hard it is to make decisions about the well-being of your children. I think Dr. Davis said it best. We agree with you. They are our most precious community resident. But we do have to be realistic and look at the real information that we have about the risks that are out there, and then do our very best, get our questions answered, and make good decisions, not just for ourselves and our family, but for our entire community. So I want to thank everyone. I want to thank Dr. Davis, Dr. Terashita, Dr. Yagane, Dr. Kurian, Dr. Morales Myers for joining us tonight. But most importantly, I want to, really thank all of you. You're obviously doing your part just by trying to get your questions answered. You're doing your part. We appreciate everything you're doing to take care of yourselves and the people you love and this wonderful community that we're all part of here in LA County. So thank you and good night.